Hello, everyone. I want to share a really nice case that we've done with you that kind of turns on its head what can be done with modern day dentistry. Everybody wants to extract teeth, put in implants, and or just extract teeth and leave it. Well, I'm here to show you some things where we can save natural teeth and keep them in place without having to remove them, do implants, any of that stuff. And this is done less and less these days because, well, implants are a great tool, but I just don't want to have people be ignorant about what can be done. So let me go through a case with you. But first of all, a little introduction. My name is Tyler Shiner. I have a little practice in a town called Vernal, Utah. It's a rural area, and I work with the most wonderful other dentists there, multi-specialist, specialist in root canals, and he does my surgeries for my patients. And without this guy, I would not be able to do these cases. The only downside is he is camera shy and doesn't want to be on the videos with me. So in the comments, let's give him some love and encouragement. Maybe we can get him to come on one of these videos in the future. But he does 80% of these cases and I just do maybe 20%. But it takes a lot of knowledge, skill, and dedication to do these cases. And anyway, hopefully one day you can meet him. Well, let's jump into this case. First of all, these are the lower right back two teeth of one of our patients, an 80-year-old gentleman. These are some older onlays that we've done. They've held up very nicely. These aren't necessarily the problem right now. The problem is down deeper, down in this area. You can see there are some cavities here along the gum line of the molar. These cavities extend, you can see it a little bit interproximally or between the teeth, okay? And then also right here, the cavities extends interproximally or next to this tooth as well. Okay, let's look at it from another standpoint. This is looking directly down onto the tooth. So if you were the top tooth and you're looking down on it, and what we see is this tooth is starting to show some signs of cracking or the restoration that's there. It's been about 10 or 15 years that this has been in place, and the top tooth is just really beating up these lower teeth here. Part of the reason is because the opposite side of the mouth doesn't have as many teeth, and so these are getting kind of worn out because this is almost exclusively the side that you choose from. Here we are looking from the tongue side. Okay, not much to see here except that the restorations, the margins or where the restorative material and the teeth meet are intact really well. You can see where we've been having some food impaction and the gums have receded here versus here. And you can also see a little bit where the cavity is right here. So one thing to notice also, this is the radiograph or the x-ray of these teeth. You can see that he has experienced some bone loss. This is the level of the bone. And you compare that to either side here, the distal, see how where the bone is higher here and also where the bone is higher here. It's because food has been getting impacted in here, causing inflammation and causing this bone to be lost. And then see in this area where it's a little bit fuzzy on the x-ray, that means that there's inflammation right there in the bone. Okay, and then here we can see where the cavities are in between the teeth. Now let's talk about the root canals. Both of these teeth have had root canals done. On the molar, the root canal looks pretty adequate. The root canal fills go all the way to the root tips. Okay, nothing too much to be concerned about there. However, with the premolar or the smaller tooth, you see that this is a post which is meant to help retain the crown. Okay, there's a little gap here between the root canal fill and the post. Okay, that's in and of itself isn't too bad, but what is worrisome to me is this is the root canal fill coming here. Here is the tip of the root, and it looks like this part was missed during the cleaning and instrumentation of this root canal. And what we can see happening is there's a little tiny infection starting here. See where that darkish area is here? That's an infection beginning on that tooth. It's only going to get bigger and become more problematic. Now I want to touch base again. Now that we can see that there's inflammation in the bone, let's look again at our photograph. Here, let's look at the gingiva. See how this is very hard to photograph, but you can see that this is red. It's not, if you look at next to it here, see how the gingiva comes up nicely between the teeth. Here it's blunted, okay? It's also very darker in color. Same thing here. It's darker in color, and you don't have the nice kind of stippling or the little tiny dots. You can kind of see it here. That is present in healthy gingiva. So we have cavities, cracked restoration, inadequate root canal fill on this one, and also irritation and inflammation in the gums and the bone. So that's all the problems that's happening with this tooth. So here we are. We'll list them out for you. Restoration's fractured, large cavities along the gum line, which is causing the inflamed gums or the gingiva and the underlying bone infected root. Okay. And so what are the treatment options in a case like this? Well, as always, people can say, hey, I don't want any treatment, leave it alone, right? It's always an option. Or the more common treatment, the most popular treatment that you see these days is extract the teeth, okay? Which then leaves us with a couple of options. You replace the teeth with a removable prosthesis, a denture of some sort, okay? Or you replace them with implants, okay? That's usually what most people are doing these days, right? They would choose to remove these teeth and place the implants. This can be a little problematic sometimes. This is an 80-year-old gentleman, not to say that he can't do that, but you know, that's quite the surgery to remove these teeth, place the implants, let the implants heal before you can restore them, put the crowns on. So it's a lengthy process. The other option is, hey, we can restore these teeth, which is what I'm going to show you today. That's the purpose of this video. So here, what I've done is I've prepared these teeth for traditional crowns, okay? That's why we've prepared these teeth, and this allows me as a restorative dentist to see how much tooth is left when we are finished here, okay? So this orange material that you see, this is actually the root canal fill material called gutta percha or GP. Once I removed the cavity, it was along the gum line, we're basically exposing part of the root canal fill here. Same with here. This is part of the root canal fill here. That means that this root canal is contaminated. Okay, we can't just restore over the top of this. Bacteria have entered into that tooth and will cause problems and infections in the future. So now we have to redo that root canal, just like we have to redo this root canal that was inadequate. Second thing that I want to point out is now we can really see how red and inflamed the gingiva is here. And another thing to point out is look how deeply decayed this tooth is, okay? We're actually underneath the gums here, and especially here on the cheek side. Very subgingival there, okay? Same thing with this tooth, very subgingival. So we're going to talk about how we can get a new crown on this tooth and have it be done in a way that's not just going to fall apart in a couple of years, which is usually what happens when people try to restore teeth like this. They just don't hold up, okay? Let's look at it from another angle. Here we're looking at it from the top. And here you can see, I think a little bit more clearly, just how deep we are, okay, below the gums on this molar. Another thing that's interesting is this, see how this tooth bulges out here? This is one of the roots, okay? And then you have what's called a furcation. This is where the tooth bifurcates into the two roots. Then there's another root right here. So this is called a furcation, what dentists call it. But just see how subgingival or how deep that decay extends towards the root of the tooth, all right? Here we are looking at it from the tongue side. Just for the sake of completeness, there is no solid tooth structure left above the gums in this area, okay? So that's a problem that we're going to correct later on. Let me show you a radiograph of the same picture, okay? One thing to notice here is here's the level of the tissue, the gingiva. Here's the level of the bone, all right? And underneath the tissue, we still have a lot of good healthy tooth structure right here and also right here. Okay, so we're going to use that good healthy tooth structure to help keep this tooth around. All right, but the first job here is we need to redo these root canals. All right, because this one is getting infected again, and this one is contaminated and will become infected again. And so we don't want any inflammation in the body, whether it's from a poor root canal, whether it's from gum disease, whether it's from cavities. We don't want any infection left in the mouth. We don't want chronic inflammation for the body. That's very unhealthy. Okay. And so here's step one of the process. The root canal filling material has been done, okay, by my partner, the endodontist. Goes and removes this material in both of the teeth. He removed the post and the material here, and we're starting the process of disinfecting these teeth. Okay. Now, one area why root canals fail or they continue to be symptomatic for some time is that not enough time is allowed to do the root canals. What I'm saying is, in this state that you can see, these teeth have been disinfected and medication put in them, and then they're left alone for a week. And then that process may be continued and done again, repeated, to ensure that all the bacteria in the biofilm is removed from these teeth. And so if you've had a root canal in the past and it's still tender, still giving you problems, one of the reasons why is it may still be infected with bacteria. It can take time to get all the bacteria, or you can never get all the bacteria, but most of the bacteria out of there so that the body can heal properly. Okay. So the patient may be in this state for a few weeks until all the infection in that is gone from the teeth. And the way that we can tell this is there's no drainage coming from inside of the teeth, and there's no symptoms, there's no tenderness, anything like that. Okay. Here we have the completed root canals. Okay. This is the filling material going all the way to the tip of the root. Same with the molar root canals. There's actually 2 canals in this one root, 3 canals in that tooth. So here we took a radiograph from the side so that you can more fully see these 2 separate canals in this root. And what does it look like clinically? This is what it looks like. Notice when I prepared these teeth that they were able to be cleansed and how the gums have healed. Okay, this is looking a lot better now. Much, much better. And there's a lot of healing taking place in the gingiva. And now this is where the magic happens that I can't show you. I wish I could show you, but there's a surgical procedure called crown lengthening, a crown lengthening procedure. And there's a variety of methods for doing crown lengthening, where essentially crown lengthening just exposes that healthy tooth structure that's under the tissues that I can use to attach my crown to. You need to have solid tooth structure all the way around the tooth for the margins or the edge of the crown to go in and hold on to. That helps retain the crown on the tooth and resist the biting forces and the chewing forces that that crown undergoes. Otherwise, the crown's just going to fall right off. All right. Secondly, the crown needs to go down to a solid tooth structure to help seal the teeth so the bacteria don't get under the crowns and form cavities and also reinfect those root canals that we worked so hard for. So let me show you a radiograph of the completed crowns. Okay. Notice how these are the margins of my crowns, and they're coming down very close to the bone here, but not quite to the bone. Okay, that's key. There needs to be at least 1.5 to 2 millimeters right here of root, cementum it's called, for the tissue, the gums to attach to. All right, that's called biologic width. It's very important that the restorations in the mouth don't impinge on what's called the biologic width. That little ring of tissue that goes around here keeps the bacteria from the mouth from getting into the bone and causing inflammation. And so if you have crowns where, the dentist wants to get down below the gingiva and use that healthy tooth structure, okay, but he doesn't have, a surgeon like I do at his disposal to do these procedures with him. So he has to just, with his drill, go down, just drill down and get into the blood and everything, and shove his crown down there, and it's just right above the bone. What you're going to have is chronic inflammation of the gums. They're going to always be red, always be bleeding and inflamed, which is an unhealthy situation like we talked about. So let me show the finished product. Here we are about a year after this was done. Notice the gingiva now. Notice how it's that light pink color that gum should be. Notice, look at this other area here. This has always been a healthy part. See how that's healthy. It's actually formed this little fold right here that's supposed to be there on healthy teeth. Okay, that's also right here, and it's also over here. And so this is healed very nicely. Here's the crowns that blend in very nicely. Okay, so here, these crowns we expect to last for many years and be free of bacteria, healthy gingiva, and also the root canal is doing well. So we've achieved all of our purposes. Let's look at these side by side. So here's the before, and then here's the after. These two teeth right here, all right, are what we fixed, and here's what they looked like before. So thank you very much for watching this video. If this is something that you would like to talk to me about and see if you would be a good candidate, then give us a call. The contact information for my office is in the beginning of the video. We'd love to hear from you. Thank you so much.